Welcome to our live webinar event for the Masters in Nursing with the Indiana University Regional Consortium. The Regional Consortium is made up of the following campuses: Indiana University East, Kokomo, Northwest, South Bend, and Southeast. We are offering this 30-minute session to give you more information about our programs, the tracks that we offer, and how the new consortium will work, and information about cost and application requirements. We will have speakers from the different campuses for the first 20 minutes or so of the webinar, and then we'll have time for a question and answer session. If you have a question, please put it in the chat and we will respond to submissions at the end. My name is Julia Mattingly, and I'm the Dean of the School of Nursing at IU Southeast in New Albany. I would like to share a little bit of information about the IU Regional Consortium and some of the upcoming changes to the MSN curriculum. Basically, you may be asking yourself, what is a consortium? Well, what that means is that we are working together to share curriculum, courses, and resources to ensure that students have the richest experiences in their MSN program at IU. The regional campuses decided to form a consortium to allow students to have more flexibility in their program while staying in their own community for graduate education. The consortium will allow for students to take mainly online classes with the ability to connect to faculty and their peers with up to 4 synchronous Zoom sessions each semester, while allowing students, again, to stay in their community for clinical. Students will have the cohort feel while getting to interact with other IU students and full-time faculty from across the state. Students will apply to their local campus, be admitted there, and sign up for courses on their campus. And students will interact with faculty from their campus for lab, clinical, and practicum experiences. We have also had some curricular changes, and you will hear more specifics from the speakers who discuss each track, but here are some highlights. Some of you may have heard about the new AACN Essentials and Competency-Based Education. In addition to adding the regional consortium, we have made some revisions to our curriculum so students are gaining access to the most current and up-to-date practices in their field. Students will take courses in population health, quality and safety, and informatics. And all students will also get a solid foundation of the 3 Ps. And the 3 Ps are physical assessment, pharmacology, and pathophysiology, as well as clinical experiences, preparing them for certification and advanced nursing practice. I will now turn over to my colleagues to provide more information about our programs and specific tracks.
My name is Paula Bauman, and I am the Associate Dean for Graduate Programs at Indiana University East. All of our Masters in Nursing programs are nationally accredited by either ACEN or CCNE, and we have been offering graduate programs for over 10 plus years, starting in 2012. All of the consortium campuses will offer the MSN degree in nursing administration and in nursing education. The Family Nurse Practitioner track is currently going to be offered at East, Kokomo, Northwest, and South Bend. I will do a brief overview of the 3 tracks, and then we will have other faculty go into more depth about the different tracks within our MSN programs. So for the nurse educator and nurse administrator tracks, we do a rolling admission, which means you could start in either the spring or the fall semester. A student could start in the summer, but they would have a more individualized plan of study. For the Family Nurse Practitioner track, it is only a spring admission. Both the administration and education tracks are 37 credit hours, and it's 44 credits for the FNP degree. The core and track classes are offered in an online format with some scheduled synchronous Zoom sessions, which means you will join online using Zoom for up to 4 times during each semester on a predetermined date. And then the rest is done online using our Canvas learning management system. And those days are going to be Thursdays from 9 to 11 a.m. Eastern time. For the FNP and administration students, the health assessment lab will require you to come to campus for practice and checkoffs on set dates, as well as you will attend clinical at your assigned site. Education students will come to campus for 2 of the education classes to get opportunities to work in the simulation lab, have experience with testing software and other teaching technologies. Our synchronous Zoom meetings are always on a Thursday from 9 to 11 Eastern Standard Time, and usually they happen around the first week of classes, one time each of the next 2 months, and then usually toward the end of the semester. Students will have all of the synchronous Zoom dates when they are admitted to the program. Students will usually take 2 classes each semester for a total of 6 to 7 credits. The administration degree is designed for either an aspiring nurse leader or someone who's already working in an administrative role and wants a more formalized education or a degree. The nurse educator track is designed for nurses who want to work in a college or university setting teaching nursing, or for someone who wants to do staff development and education in a hospital setting. Our family nurse practitioner track prepares students to sit for certification to work as a family nurse practitioner. It is a once-a-year admission for this program, and the deadline for applications for the upcoming admission cycle is September 15th of this year. And that would allow for a January 2025 start. I will now turn it over to our administration, education, and family nurse practitioner faculty to provide even additional information about the program.
Hey, my name is Mary Burke, and I'm professor of nursing at Indiana University, Kokomo. I will give a short information session with a little bit deeper dive into nursing administration and nursing education tracks. So the nursing administration track is a comprehensive online degree with some classes, like what was said earlier, meeting live, which means online live, up to 4 times during the semester. So you'll still be doing it from home, but it will be online live during the semester. In addition, to foster a sense of community and enhance your learning experience, there'll be that 1 credit lab for assessment class that meets in person. And then there's a 1 credit practicum during the program. This is a great opportunity for you to meet with classmates in person. You've gotten to know them online, so having these opportunities to meet face-to-face is a great way to network. You may be wondering, what will I learn? What skills? The nursing administration curriculum is focused on building a solid foundation in leadership, including managing employees to achieve healthcare goals, understanding hospital finance, such as revenues and costs, practicing principles related to the quality and safety of healthcare systems, legalities of care delivery, and other business-related aspects. Each course builds your knowledge and skills to prepare you for that practicum. At the end of your program, faculty will design specifically for you a 3 credit hour practicum experience that provides real-world experience within healthcare organizations for that aspiring nurse leader or someone who's already in an administrative role. For the nurse education track, it's a hybrid program, and that means 2 of the courses out of the 11 will be taught in person at your home campus. Those courses are Teaching and Nursing, T670, and Nursing Curriculum, T615. These 2 courses will provide many in-person experiential learning experiences to advance your knowledge and skills as an educator. So why is a degree essential to be an educator? Why can't you be an educator with a BSN? You will learn more advanced skills on how to design and create engaging, didactic, clinical, or hospital-focused instructions, because some of you may want to become a hospital educator. The 2 in-person courses provide an environment where that instructor can facilitate your learning of the instructional technologies such as gaming, graphic design, animation embedded instruction. Faculty focus on your skill level and the pace at which you learn best. So having that face-to-face, she can develop you with your technology skills at your pace. Like nursing administration, the remaining 9 courses will be taught online, with some meeting live online up to 4 times. There will also be that 1 credit lab, as we talked about before, where you can network with other educators or administration students. Lastly, but a significant strength of our program, faculty will also design a practicum for you, 3 credit hour specifically for you that provides that real world experience where you can practice your advanced knowledge and skills within an academic or hospital environment. Our goal is to ensure our students are well prepared for future roles. So what makes our program different from the plethora of options you have? We prepare you with the knowledge and skills to practice in the real world. We offer much more than reading a chapter in the textbook and discussion boards. The context in which we designed our programs is the very environments in which you will practice after you earn your master's degree. Next, Caitlin will talk about the Family Nurse Practitioner Program. Caitlin?
Thanks, Mary. My name is Caitlin Volemic. I am the MSN Program Director and a Clinical Associate Professor at IU South Bend. I'm also a family nurse practitioner and graduated from our program here at IU South Bend. Amid the ever-changing U.S. healthcare landscape, nurse practitioners have become the healthcare provider of choice for millions of Americans. Nurse practitioners diagnose, treat, and help prevent common and acute illnesses and manage chronic disease. Health promotion and disease prevention are a primary focus. Nurse practitioners are advanced practice registered nurses with specialized training. There are many different specialties one can choose from: pediatrics, women's health, adult gerontology, acute care, and others. However, family nurse practitioners have the broadest focus and care for a wide variety of patients of all ages across the lifespan, including infants, adolescents, adults, and the elderly. FNPs work in various healthcare environments such as hospitals, primary care offices, outpatient facilities, urgent care clinics, private practice, community health centers, and long-term care facilities. Our FNP track includes core classes in quality and safety, informatics, population health, leadership, and the 3 Ps: advanced pathophysiology, advanced pharmacology, and advanced health assessment across the lifespan. Our primary care courses are designed to allow students to take advantage of caring for any type of patient while in the outpatient clinical setting. So if you enjoy working with diverse populations, making a difference in your community, and are skilled at empowering patients to maintain their health throughout their lifespan, then a career as a family nurse practitioner may be the right choice for you. Throughout the 4 primary care courses, you'll complete 600 clinical hours. The first 2 primary care courses have 75 hours minimum required, which is usually 1 day a week of clinical across the semester. The 3rd and 4th primary care courses have 225 hours minimum required. This is about 2 days a week in the clinic, on top of that day of classwork as well. Because we do not have separate pediatrics and women's health classes, a set number of hours will be required in pediatrics, women's health, and geriatrics. We're partners in the clinical placement process. Obtaining clinical placements have become more challenging. This is especially true for pediatric and women's health hours. There are many FNP students seeking clinical sites, which has made the clinical placements competitive. As a result, many health systems will only provide clinical placements for their own employees who are seeking advanced degrees. Most health systems have a process in place to apply for clinical placement, and most will not allow clinical placements to be arranged solely by the student and preceptor without going through a campus representative for approval. So our program directors confirm all placements for students and will work with you to obtain the best clinical experiences for you. Now, Ann Mitchell, an advisor from IU Northwest, will discuss the application and admission process.
Thank you, Caitlin. Yes, I'm Ann Mitchell, an academic advisor for the MSN program at IU Northwest, and I help students with the application and admission processes. The best place to begin a search for information about the admission requirements is the official website for the consortium. It is go.iu.edu/regional-msn. After this webinar, you can check that site for information about admission requirements, application deadlines, and the curriculum for the program. You can also use the link provided on the webpage for each campus and program to begin your application process. So how do you apply? You can begin your application using the links provided on the MSN webpage for the campus closest to you. The application fee is currently waived, so starting the process is free. Be sure to keep deadlines in mind and be aware that completing the application can take some time, as there are several parts to the application process. You will note in the grid that's showing on the slide that the application for the FNP track opens April 1st and closes September 15th. There is October notification of admission offers, and the program actually begins every spring semester in January. The education track and administration tracks, as was mentioned previously, are open all year. And the application deadline is 2 weeks prior to the start of each semester. So notification is rolling, and you can start August, January, or May. Items you will submit or complete as a part of the application process include all non-IU college transcripts, a resume or CV, a personal statement, 2 references, a drug screen, and a background check. Your background, we're recommending a BSN. You have to have your BSN or be in your final semester. And you have to have an active, unrestricted RN license in Indiana. And I will read this in a little more detail. So you have to have your BSN degree and an unrestricted RN license that is valid in the state of Indiana. The faculty who review the applications also look at your experience as an RN. 1 year preferred for education or administration, and 2 years for FNP, or 2 years experience by the time you would take the assessment course for FNP. The website will tell you that you must have completed your BSN, but I want to take a moment to encourage those in the RN to BSN programs to apply even before your degree is complete. If you are pursuing an RN to BSN program, you are welcome to complete your application as you're nearing your final semester in that program. It's possible to be admitted contingent upon successful completion of your RN to BSN. So for example, let's say that you plan to complete your RN to BSN in December 2024. You can apply for admission to the FNP by September 15th, 2024, and be considered for entry in the spring 2025 cohort. Your admission would just be contingent upon successfully completing your BSN degree in December. Once you begin to submit materials, each campus has a person whose role it is to stay in touch with you as you work on your application, to help with navigating the process and any questions that come along the way. Aside from questions about the application process, the most common question is about the cost for programs. The tuition is pretty standard across programs. It's $448.23 per credit hour. That's for in-state students. There are some other fees involved. There are mandatory fees. Those vary a little bit. The couple of costs that I saw were from $168.47 to $178.73. However, what's not included in the grid that you see, or the chart on the slide, is not, I'm sorry, what you don't see are the clinical fees and the textbook fees. So your approximate cost for the FNP would be about $20,973 for the whole thing. Just remember, each year, sometimes the fees go up ever so slightly. And for the MSN, education or administrative tracks, that would run around $17,700. Please note that residents of several Western Ohio counties can benefit from in-state rates as reciprocity students. Otherwise, tuition for non-residents is $1,303.57 per credit hour. Additional costs include expenses for the background check, drugs and drug screen for admission processes, and of course, the textbooks. FNP students also maintain a stipend account, so that would be an additional expense. Unfortunately, textbook expenses vary so much, it's difficult to provide you with an estimate for that. It depends on the format that the student chooses, printed book versus digital, and if they rent or buy. So you might ask, is there help available? There are some scholarship opportunities, and we assist with finding preceptors and clinical placements at no extra cost to you. We encourage students to apply for financial aid with FAFSA. The experts on our financial aid office or on the team can answer any questions about that application process. Be sure to tell them that you are a graduate student applying for the MSN program because the aid available is different for grad students. Thank you.
Okay, so now we would like to take a look at our chat room to see what questions have been posed. And if you haven't had an opportunity to put a question in the chat room, please do that. Okay. So I'm gonna scroll through. So the first question I see is, I didn't begin working with my RN license until February of 2023. Will I be able to apply for the FNP program starting in January 2025? Caitlin, I'll let you answer that one.
Yep, absolutely, you can apply. So by the time you start the program, you'll be almost at that 2 years of experience. And like she mentioned, we really liked you to have that experience before you take health assessment, and that's taken in the summer session, the first summer session. So definitely feel free to go ahead and apply.
Thanks.
So one question I frequently get is, can I work full-time while I'm in this program? Whether it be the administration, education, or FNP track. So does somebody want to take that one?
I'll take it as the FNP for sure, because obviously the clinical hours, as I mentioned, you often will have for the first 2 clinical courses, 1 day a week on top of the day of classes. So Thursday, if we have classes that meet synchronously, or even face-to-face for like the health assessment class, you don't start clinicals until your 2nd year of the program. So the 2nd year is when we expect you to have at least 2 days available for class and clinical. And then the 3rd and 4th, the final 6th and 7th semester of the track moves up to 2 days in the clinical. So therefore, it does get a little bit more time restrictive for folks that might work Monday through Friday. So I help to mentor those students as to should they work part-time, PRN, weekend alternative, et cetera, if they're able to. So that at least for FNP, we do try to let students know ahead of time what those daily requirements will be for clinical. So it's a little bit trickier for the FNP, especially if they're working a Monday through Friday job.
But if they're working 3 12-hour shifts and they can save up some of their PTO time toward those last 2 semesters, some folks are able to still maintain a full-time employment if required.
Absolutely. Yep. We have many students that stay full-time, either going to weekend alternative or at least knowing ahead of time what their days may look like in regards to their clinicals so that they can plan and prepare ahead of time. Yep. a question that looks like it popped up from that is the clinical day considered an 8-hour day? Yes, for the most part. It depends on what the preceptor and provider's schedule looks like. So some will work 10-hour days depending on the site. And so sometimes if you're doing a 10-hour day, not that we require you to be there the full time, but it's nice to follow what the preceptor's schedule is like. So if it's a 6-hour day, obviously then we would have to figure out your schedule to maintain and get the hours that you need. But yeah, the clinical day anywhere from 6 to 10 hours is what I've seen traditionally.
So I have another question. Explain more about the drug screen and background check as part of the application process. So I can probably answer that, and then if the others want to chime in. So part of the application process is that you complete a drug screen and background check. And as part of the web admit application, there is a link there that gives you more information. But we use Castle Branch, which is a company that does tracking and does background checks and drug screens. So the person on the campus who's working with you for admission will give you the information about signing up with Castle Branch, and then Castle Branch takes care of doing the background check and putting the order through to the lab location where you'll do the drug screen. And that does need to be completed and results back by the September 15th deadline for the FNP students. Do we have any other questions that I see?
There's another one, Paula, about do you have a BSN to DNP option where someone can obtain an MSN and keep going without readmission to DNP? And currently, we're working on having a DNP consortium, but at the present time, we do not have a continual but we expect to have one, within 2 or 3 years. There's approval processes that we have to go through. Anybody have more to add to that?
There is another question. Is it reasonable to expect to work 2 to 3 12-hour shifts a week through the first couple of semesters of the FNP program?
Yeah, and that's why we've kind of transitioned to this hybrid model and this consortium model, is so that it allows for that. Currently students have a full day in class right now that they come to campuses for. And so with only having a couple of possible synchronous meetings required a semester, that opens the opportunity for folks to do their studies and their reviews. If they are a night owl and likes to do it at midnight, I don't, but there are those people that want to do their studying and review at different times of the day. Yes, absolutely reasonable to work 2 to 3 12-hour shifts a week. Our students currently are doing that type of work on top of their clinicals and on top of their class days. So exactly able to be doing that. Yes, I would agree.
Sometimes we get questions about the practicums for nursing administration and nursing education. For nursing administration, through their direct experiences, students gain a deep understanding of the intricate dynamics of the healthcare leadership and management through organizational partnership, where they actually do an evidence-based practice project to evaluate a nursing practice, a policy, or procedure based on the current evidence. So as a result, students can observe and actively engage in these real-world scenarios, honing their critical skills in decision-making, then problem-solving, and strategic planning within that healthcare setting. And that is set up by your faculty person, when she will have you meet with, and she will facilitate that MSN prepared preceptor. For the nursing education practicum, you will have topics in class related to FERPA, incivility, learning contracts, and many others. But your faculty will also assign you to an MSN prepared preceptor that could be a faculty person at a university or community college, or an MS paired preceptor in the hospital if you want to be a hospital educator. These preceptors will allow you to teach their students or nurses, including a classroom or clinical. Collaborating with your assigned preceptor, your instructor will help you prepare, design, and develop that instruction appropriate for that practicum experience. So you are not going to be left on your own to prepare for that. So upon completing that experience, you will now have the knowledge and skills to be workforce ready as a nurse educator. So that's our 2 practicum. They're not quite clinical experiences, but they are set aside times that you will have clocked hours that you will need to be practicing, either for administration or education.
And in the education and administration track, 300 practicum hours are required. And we have those set up within the semester, the 2 different semesters, 75 hours in one and 225 in the other. Okay, so we had one last question. So the FNP program can start in the spring or the fall. Do you know when the fall start application would be? And I think Caitlin responded that the FNP only starts in January and it's a one-time admission. And that is because of the clinical placements and what is required to place students. It's too difficult for us to do more than, a twice-a-year admission process at this time and have ample clinical opportunities for students. Okay, so I would like to thank all of you for attending or watching today's webinar. If you tune in to watch the recording, a reminder that our contact information and a link to the MSN Regional Consortium web page is provided on the screen. We hope you decide to pursue your MSN at a regional IU campus. We really look forward to hearing from you, and we hope you have a great rest of the day.